To control some disease, we improve the sanitation health in the village. Sometimes if some outbreak happen, like dengue, hemorrhagic fever happen, we cooperate with the village health volunteer to control the outbreaks. And I think that one of the things that we do is because we are public health, and that's the reason why public health is very important. And I think it should be better if public health in Hawaii, public health study in Hawaii separate from the medical school and become the new school of public health. Okay, thank you.
Well, my name is Doris Siegel Matsunaga. I'm class of 1980 at the School of Public Health, UH. And I'm very pleased to hear the value, Dean Hedges, that you put on public health, and I can hear it very clearly. And you know, having watched the debates, the other debates last night, and having listened to Charlene, of course, I can't help but think about Joe the plumber. Well, my name is Doris Siegel Matsunaga. I'm class of 1980 at the School of Public Health, UH. And I'm very pleased to hear the value, Dean Hedges, that you put on public health, and I can hear it very clearly. And you know, having watched the debates, the other debates last night, and having listened to Charlene, of course, I can't help but think about Joe the plumber. I'm not going to talk about Joe the plumber. It's those people, those faces that make all of this real. And I'm thinking of some of the people that were here at the School of Public Health when it was a school, and I can't help but think that unless there's a School of Public Health, the next generation of those folks won't be here again without that level of support. I'm thinking of, I recently had the opportunity to take a trip to Pohnpei in Federated States of Micronesia because of my job at the Cancer Information Service, and in collaboration with the Pacific SEED, Center of Excellence in Eliminating Disparities at the JAPSOM. And on this trip, I encountered my classmate, Viliami Puloka, Dr. Puloka, who was, got his public health degree alongside with me in community health education in 1980. And he later went to, got his medical degree in Fiji and became a physician. But he's doing public health prevention work throughout the Pacific now. And is clearly an example of those two disciplines being married, but I don't think he would have ever come to a university that didn't have a School of Public Health with an international program and that level of support for students in the Pacific to allow him to come. I also encountered there Kathy Benjamin, who is now the chief nurse at Pohnpei Hospital, and she got her degree in public health at the School of Public Health and Maternal Child Health. And as part of her education, she was placed as an intern at Kaliupalama Health Center, where I was the director of health education. And she became our first interpreter for patients from that part of the world, as we were beginning to have more folks come in from Federated States of Micronesia to our clinic. And she's back there now doing really important work. But again, I think she's someone else who, without a full School of Public Health and all the resources that offered, the next generation of folks like her may never come here. They'll go elsewhere for their education. And so I'm just thinking of folks like that. One other I want to mention is Dr. Felicia Hodge, who is a preeminent researcher in Native American research, who I think we might have gotten as a faculty member at one point if we had a full School of Public Health. And we could be doing incredible things in community-based participatory research in Hawaii, connected to the U.S. mainland, connected to international issues with someone of her caliber, and there are many others like her. So I think it's that level of folks that we're not going to get. I don't know what the answers are to the fiscal issues, but I think our vision can't be constricted by the current economic times. So we'll consider all that as we try and navigate.
Go ahead, 30-second rebuttal.
Please.
I appreciate the comments tremendously, and you may indeed be correct. There are some individuals who would be most attracted to a program that's affiliated with a freestanding school. I do wish to point out that there are a number of successful departments of public health within medical schools that function quite well and have a pretty strong international recruitment based upon the quality of the education and the collegiality that they can develop. Oregon Health and Science University was one of those with Tom Becker's program, which not only drew a large number of Native Americans into the program, but also had a strong Pacific influx of trainees. So, you know, I know those programs are there and do exist, but there may be some individuals who may not be attracted unless the structure is a certain way. But I think the opportunity exists to configure it in different manners. I think our important task, as you say, is not so much to configure whatever we're doing for the circumstance we see ourselves in today, but really where we'd like to be in the future. And I support that view. My advocacy at this time is really for the importance of taking a population-based community health approach and looking at it in the broadest sense, and looking at how we should be working together and how we can get the greatest synergy. I'm not totally convinced that separate educational entities are the best way to do that. That's why I'm bringing this out, putting it out for discussion. And I would just hope that people keep an open mind on that and look at how different possibilities might work in the future. But in the process of my recruitment, I want to say that I was very much aware of commitments that have been made at a high level to this institution, and it is not my intent to in any way you know, not allow a process to go forward. I do wish to say that I think we ought to think about what we're doing and the consequences of that, and it may be that there's an alternative approach and mechanism of building a program that would accomplish what we seek to do without necessarily having some duplicative processes put in place. And that's, I think, the essence of the discussion I hope we have today, and I think we've successfully had that discussion.